नमस्कार दोस्तों, welcome to channel Toxicology on Board. Today in this video we'll be discussing another DABT topic, that is hyperostosis, that is fluoride. So let's directly dive into the question. This question is taken from a ABT recertification May 12, 2000. That is the question paper. Okay, so the question is chronic absorption of which of the following results in hyperostosis. So we need to identify which of the following metals will cause hyperostosis. Through this question we'll also read what is hyperostosis. Okay, what is the metal which is causing this hyperostosis. We have option A cyanide, option B we have sulfide, option C we have fluoride, option D we have borate, option E we have oxalate. The right answer will be in the green text, which is option C, fluoride. So let's understand what is hyperostosis. Okay, hyperostosis is nothing but it is an abnormal thickening or excessive growth of the bone tissue. Okay, so it is seen in the case of skull as well as in the case of spinal cord, often forming new bone, seen in various conditions like, you have to remember this condition, diffuse idiopathic skeletal hyperostosis, which is nothing but DISH, affecting your spine. This is your normal spine. This is the affected spine with hyperostosis, or localized forms such as hyperostosis frontalis interna, skull thickening. This is a normal skull. Here you can see in the case of hyperostosis, thickening of the skull takes place. So while some types like dish, that is nothing but diffuse idiopathic skeletal hyperostosis, involve soft tissue calcification. Others are linked to genetic disorder. Some of them are related to genetic disorders, which are tumor meningiomas or medications like isotretinoin. So there are recent observations with respect to FDA audit, where they have seen some kind of hazardous observation with respect of isotretinoin. So read about isotretinoin also in the FDA web page, and potentially causing stiffness, swallowing issues, and breathing problems. That medical terminology for swallowing issues is nothing but dysphagia. Okay, so so let's see what are the different types and common types of hyperostosis and what are the examples. As we have seen in the previous slide, one is DISH, that is diffuse idiopathic skeletal hyperostosis. This is nothing but ossification, bone formation in spinal ligaments, causing stiffness and pain, sometimes affecting swallowing or breathing. Second one is hyperostosis frontalis interna, which is with respect to your skull. Thickening of the inner skull, often benign. Okay, it is not malignant but can be associated with other issues. Third one is osteosclerosis. Osteosclerosis is increased bone density. If you see, the bone density will be increased without shape change, and this terminology, medical terminology, is called Paget disease. So please go back and read in detail about what is Paget disease. And next one is, fourth type is melorhiostosis, a rare localized form of causing dripping candle wax. This is called dripping candle wax. It is also seen in the case of bones. And last one is Caffey's disease, which is nothing but infantile cortical hyperostosis. Here you can see in the case of Caffey disease, rapid painful bone swelling. This is seen in the case of infants. So what are the different causes for causing this hyperostosis? One is idiopathic. So please, idiopathic is something for which the reason is unknown. So I would also request you pause the video and read these terminologies: idiopathic, idiosyncratic, iatrogenic. These are all terms, with medical knowledge terms, which comes with the word I. So you will be keep on getting confused with these with words. To try to make notes. Idiopathic, once again I am repeating, iatrogenic, idiosyncratic. So these are the things starting with I letter. So read. So let's go back to the causes. Some certain causes are genetic. Okay, inherited conditions like Camurati Engelmann disease. So here you can see this in the picture. Then we have tumor. As I told you, some of them might be associated with benign or malignant tumor, direct invasion or react to meningiomas. And certain times drugs might also be responsible for causing this hyperostosis. Example we have seen in the previous slide, that is isotretinoin, or some other examples like phenytoin, which is an anticonvulsant drug. Next, metabolite related causes are Paget disease. I told you, please read in detail about Paget disease, where increase in bone density is seen. Okay, so what are the symptoms and effects? How you are going to identify if an individual, whether he has been is suffering from hyperostosis? Back pain, stiffness, difficulty in swallowing. The medical terminology is dysphagia. Hoarseness, sleep apnea, difficulty in sleep from neck bone spurs, neurological issues like numbness or weakness, and bone fragility, fractures, that is you can see in the case of dish. Okay, diffuse idiopathic skeletal hyperostosis. Then next we have how we are going to do diagnosis and treatment. You yourself you can read by X-ray or CT scan. So let's directly dive into the important pages which are mentioned in Claesson's ninth edition. Page number 1145 as well as 1146. It is given in the chapter toxic effects of metals. So in that one metal is fluorine. Okay, so fluorine. So in this video we'll try to in detail read about fluorine. So that any question with respect to fluorine, if it comes in our DABT exam, we will be able to answer it. So these are the important pages for 1145 as well 1146. Under fluorine, these important things have been discussed. So fluorine was isolated in 1886 by this particular scientist Henry Moissan. He was awarded Nobel Prize in 1906. So this is in the chemistry field. So if you are a passionate scientist, always try to remember in every year what are the list of the scientists with respect to the field, whether it is chemistry, biology, molecular, that you try to remember. I'm not saying it is important from the exam point of view, but if you are a passionate scientist, you try to make this particular award as your biggest goal, so that you will be able to do some innovative in your scientific field. Okay, also try to remember with respect to toxicology, what is the importance of years of 1906, what is the FDA important regulatory act which was formed in 1906. That's it. Go back and read in detail. Then next we have fluorides are organic inorganic compounds containing non-metallic element fluorine. This is important. So in the periodic table or in the toxic effects of metals, the chapter is there, no? Try to see what are the metals are there. In that fluorine is also there. Fluoride is an essential component of normal mineralization. So whenever this mineralization of bone is taking place, now this is an essential component of bones and dental enamel. So in two things, one is you can see in the case of bones and another you can see in the case of enamel. It has been widely used due to reduce the prevalence and severity of the dental caries in the case of children. So this is very important. So in detail we are going to read in next two slides about dental caries also. So we have fluorosilicic acid and sodium fluorosilicate. You have to understand this fluorine, no, it is unstable, so it will be available in the salt forms. So in the next two slides you will be seeing either hydrogen fluoride, either you will come across sodium fluoride, either you will come across fluorosilicic acid or sodium fluorosilicate. These are the terms you will, these are the salt forms of fluoride that will be coming across in the next two slides. So fluorosilicic acid and sodium fluorosilicate have been used in water fluoridation since 1940. So in order to purify the water, these particular two salt forms of fluorine we are using. Next one is adequate intake. So this is again important. I have previously discussed in my previous slide video also. Try to read about HBELs, that is health based exposure limits. In that also, particularly coming to metals, which if they are the essential metals are there, no, then you need to have some adequate intake which is there in the form of diet. So for this fluorine or fluoride, whatever you say, they have an adequate intake which is nothing but 0.05 mg per kg per day. That is in the case of adults. That too you have to see, if it is a 50 kg adult, you multiply 0.05 into 50 kg, 60 kg adult, like that. But in the case of infants, this is much lower. It might be 0.04 or 0.03, like that. Okay. Toxicologically important fluoride compounds include, as I told you, hydrogen fluoride and sodium fluoride. Major sources of fluoride intake in general population. So whenever you are doing risk assessment, there are two different types of population. One is general population. Second one is your industrial population, means worker population. So in the case of general population, how the exposure is through either water, either through food, or fluoride containing dental products. If they're using any toothpaste or some gargle mouthwash, at that time they will get exposed to the excessive fluoride content, because repeatedly they are using twice in a day they are using this type of mouth care products. Excessive intake of fluorides can be observed from environmental sources. So other type of exposure is through environmental sources. That is in the case of drinking water. Certain times, if the drinking water is not purified enough, the naturally the drinking water might contain high fluoride content. And indoor fluoride air pollution, that is particularly in the western countries, you can see that because of the excessive low temperature, no, coal will be burned. So high fluoride containing coal, if they are burnt in the inside the oven, then there is a air pollution that which contain high fluoride content. So this you can see the dental enamel. This is the healthy teeth, how the dental is taking place. Pause the video and try to read about the anatomy of tooth also, so that you can visualize and keep it in your mind. So important part will be crown, neck, and teeth will be there. So enamel is the outermost layer part of the teeth, so very important. So in continuation, that only page number 1145 and 46 we are discussing. So we have fluorides. They are readily absorbed from the GI tract. This is important. In the stomach, they are getting readily absorbed, and once they are absorbed, they are rapidly distributed throughout your body. Okay, there is no restrictions. And 99% of the fluoride, it is in the either it is in the bone or it is in the teeth. Okay, fluoride is incorporated in bone by. So what is happening, if you look into the typical structure of your bone, in bone, if you see, it is made in the bone structure. If you see, this hydroxyapatite will be there, in which OH ions are there, hydroxyl ions are there. This fluoride will go and replace this OH ions in the hydroxyapatite in your bone and your teeth, and as a result, what it is forms, it forms hydroxyfluoroapatite. Once again, I repeat, fluoride is incorporated into your bone by replacing OH, hydroxyl ion, in the hydroxyapatite. In our bone, we have hydroxyapatite in which OH ions are there. OH ions are replaced with fluoride to form hydroxyfluoroapatite. This is the important thing that you have to remember in your brain. Okay, fluoride in bone can be remobilized. So bone remodeling, that also you have come across in your academics, I guess. So fluoride in bone can be remobilized slowly as a result of ongoing process called bone remodeling, especially in the case of young children, because children are still growing. They are still in the growing stage. So bone remodeling you can see more in the case of children. As a result, whatever the fluoride which is deposited in the hydroxyapatite, it undergoes remobilization. Fluoride is readily transferred across the placenta, and it is not transferred in your breast milk. This is again very important. Fluorides are mainly excreted. The route of excretion is urine, and plasma and urine fluoride. Now we are discussing about something about biomarkers. So plasma and urine fluoride levels are related to fluoride intake. Okay, so how you are going to assess a certain individual has been exposed to excess fluoride exposure, that you have to do by either analysis of the plasma and urine. In that you will be checking your fluoride content. Okay, so what are the biomarkers for this excess exposure? You have to check either hair, fingernail, tooth enamel are the indicators for long-term response. So pause the video here, try to understand this crystal structure, the bone structure, hydroxyapatite, how fluorine is getting deposited and forming hydroxyfluoroapatite, as well as read about mechanism of bone remodeling. What are the precursors like osteoclast, osteoblast? Osteoblasts are the one which are involved in the bone formation. Osteoclasts are the one which are involved in bone resorption. So also try to read about bone remodeling. So these are the three important things you try to remember: osteoclast, osteoblast. Okay, so now we will be learning in detail more about in the page 45, 46 only, which is given. Okay, so we will be reading about two types of fluorosis. One is dental fluorosis, another is skeletal fluorosis. So under dental fluorosis, excessive fluoride intake. So we already have intake value 0.05 mg per kg in the case of adults. So excessive fluoride intake from water during the period of enamel formation in the case of children, children still growing, it will cause dental fluorosis. So what are the reasons for causing dental fluorosis, that you have to remember. So in the mild form, what you see, it is having white opaque area on the tooth surface. Here you can see, this is the picture you can look it into, wherein it is in a severe form of dental fluorosis is there, no, then you will find yellowish brown to black stains and severe pitting of the teeth. Here you can see in the case of moderate and severe dental fluorosis how it is. So dental fluorosis incidence and severity in some instances can be decreased by. So what as I told you, know, for in order to fluoridation of the water, you're adding HF or sodium fluoride. So that can be stopped. Okay. Inappropriate use of fluoride toothpaste. So how you can avoid this dental fluorosis means using stoppage of using of those toothpaste which are having high content of fluoride or fluoride supplements in the case of young children, and more common in the case of endemic environmental fluorosis. So if by default, if the environmental is a source for the contamination of this fluorine, then you have to mitigate the risk. So next we are discussing about after dental fluorosis. Second type we are discussing, that is skeletal fluorosis. So long term exposure to very high oral doses of fluoride or occupational exposure to cryolite dust. There are certain workers who are working in the industrial area, in their workplace. If they are getting exposed to cryolite dust, there is a chance of getting skeletal fluorosis. Okay. So found in the developing countries, more than developed countries, are associated with high fluoride intake coupled with malnutrition. Already they are taking less nutrient, and if it is excess fluoride exposure is there, then so in case of India, you also read about Nalagonda. Nalagonda district is there in the case of Andhra Pradesh, where fluoride, excessive fluoride exposure is there. So what are the groundwater itself, the lakes or groundwater itself is polluted with fluoride content in that particular area. Similarly, you read about Bangladesh. In the Bangladesh also arsenic exposure is there. So these are the two important thing, environmental endemic exposure I can say. So coming back to skeletal fluorosis, symptom, so you cannot identify the symptoms until unless advanced stage is reached. So generally this fluoride get deposited. These are the regions: neck. It will go and deposit your knee, in your knee, in your pelvic area, as well as your shoulder and joints, as well as bones. Okay, that will make the certain individual very difficult to move and walk. Okay, and if you look into the what are the typical symptoms of skeletal fluorosis, no, they're similar to that of the arthritis. Rheumatic arthritis is there, no, like sporadic pain, back stiffness, burning like sensation, pricking and tickling in the limbs, muscle weakness, and chronic fatigue. So uh, why these are the means these symptoms are also associated with abnormal calcium deposits in the bones as well as ligaments. Okay, so if you look into the advanced stages, what are the symptoms you can see in the case of skeletal fluorosis is osteoporosis in the long bones, right, and the bone outgrowth. So this is the skeletal fluorosis. You can clearly see this is the dental fluorosis. This is the normal RBC, non-skeletal skeletal fluorosis, RBC macrophage changes. Okay, so invertebrate, the vertebrate may fuse together and eventually the victim will be crippled. That is skeletal fluorosis or crippling, you can see. And there are two types of, one is kyphosis. This is hump back you can see, and lordosis, which is nothing but arched back you can see. This is the normal curves, and this is the kyphosis where you can see a curve is there, and this is lordosis. So pause the video here, try to learn these terms kyphosis as well lordosis. Okay, and let's continue with skeletal fluorosis. More details are given about skeletal fluorosis in the lesson. So conflicting, there is something well, like, is there any association with the fluoride exposure and the cancer? That kind of studies are discussed in this particular paragraph. So there is a conflicting data regarding the association between the fluoride exposure and the incidence of osteosarcoma, a rare bone tumor. So this is always you will see in the case of epidemiological studies where there is an effect. You want to identify the cause. Is there any causal effect relationship? So in your DABT syllabus there is some kind of thing is there called causal effect, a causal relationship is there or not. So you can see in the textbook it is very clearly given. A case control study in the United States found an association between fluoride exposure in the drinking water. The exposure is through drinking water during childhood, and the incidence of osteosarcoma among males but not among females. So again you can see the difference in the, see, there are children, okay, and these children, they found some osteosarcoma is there, that too in the case of male. Boys it is more when compared to females. And you can see the exposure is through drinking water. The drinking water is there in which it is fluoride content is high. That drinking water is being consumed by both boys as well as girls, and boys are showing osteosarcoma but the girls are showing less. So there is a sex difference is also, gender differentiation is also there. Okay, so another important thing you learn about is NTP, that is National Toxicology Program. This is there in the TABT syllabus also. So They usually conduct mice and rat studies. They will be doing gene tox studies. They'll be doing 2-year carcinoma studies, and dose range finding studies also they will be doing for certain chemicals which are frequently found, and they find that these are hazardous. So NTP is the organization which conduct these studies. So they have done these studies on sodium fluoride. So let's see what they have done. In a rodent study, found no evidence of carcinogenicity in male as well as female mice as well as female rats exposed to sodium fluoride in the drinking water, although equivocal evidence they have found in the case of male rats. So whenever the sodium fluoride is there, exposure, NTP study, they didn't find in male and female mice as well as female rats, but male rats they have found few osteosarcoma. That too see equivocal evidence, and there were weak dose response trend. So whenever you're reading about dose response curve, you have to whether the dose response curve is steep, whether it is a dose trend is there strongly, dose response trend is there. These terminologies are very important in order to interpret the particular finding. Okay, so lastly, that's why they're saying caution should be taken before any conclusions are made from such data, and more studies are needed. So based on this one particular study, you cannot conclude that this particular there is an association with the fluoride as well as with the cancer osteosarcoma. Okay, that's why. So it is still is open to toxicologists and more scientists like us to do more studies before establishing any proper conclusion. Okay, other health effects include respiratory tract, skin and eye irritation, inhalation exposure of hydrogen fluoride and fluorine gas. This is the fluorine gas which is yellow in color. Okay, and GI symptoms occur with excessive ingestion of fluoride. As we can see, fluoride is highly absorbed from the GI tract, we have seen. And chronic endemic fluorosis, what are the things will lead to muscle fiber degeneration, low hemoglobin levels, skin rashes, neurological manifestation, compromised immunity, endocrine effects. So endo endemic fluorosis from coal burn in China. So in China, excessive coal burning will lead to this endemic fluorosis. It is seen concurrently along with acidicosis. As I told you, no, excessive arsenic exposure will cause this type of symptoms. So I told you about Bangladesh also. Go back and check in detail. So from this video, we have learnt about fluoride. Okay, we have learnt about hyperhostosis, two different types of dental fluorosis and skeletal fluorosis we have learnt. Okay, in detail we have learnt about the kinetics about of all this fluorosis, its intake, adequate intake we have seen. So hope from this video you will be able to learn. Thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on Board. All the best for your exam.